It's an honor to be here. Thank you, Superintendent, and the whole Northern Lincoln Elementary School family for hosting us today. I also want to acknowledge Deputy Commissioner Riley, the whole RI team, and all the teachers, school nurse teachers, other staff, and administrators who have helped us weather the COVID-19 storm together. Looking at the data picture together, it's clear that COVID-19 is still very much with us. We have seen significant increases in the last 2 weeks in cases, significant increases in percent positivity, and increases in hospital admissions. This has also been occurring throughout our region. Almost all our cases right now are still Delta variant cases. But as we've outlined, the state's entire COVID response team is tracking very closely the situation to watch for the Omicron variant. What has drawn the attention of international health officials regarding this variant is that it has a constellation of roughly 50 different mutations being observed for the first time in one single variant. 30 of the mutations alone are being observed in the spike protein, which is the protein involved in infecting human cells. This has allowed the Omicron variant to spread very readily in South Africa, where it was first identified. We have a lot to still learn about this variant, but we know some key elements, and that's what we're here sharing today. Getting vaccinated, particularly our younger students who are of age, and we need to get as many vaccinated as possible. Wearing a mask when you're indoors and getting tested as frequently as needed. The other elements of this new variant includes learning whether or not the variant is going to be more infectious. It includes determining if it is more or less severe, and learning about how well the vaccines protect against it, and learning how well our available medications will work against it. We will continue to ascertain that information as it's learned internationally and share with you, while continuing to put forward with the information that we know. Give you the tools that you need, getting vaccinated now, wearing your mask indoors, and getting tested regularly. The main reasons that I can say as a scientist and a clinician that we have what we need to be able to go forward confidently are because, first of all, Dr. Eva King and her tremendous team at the State Health Laboratories already have the genomic surveillance system in place to detect this Omicron variant if it establishes a presence here in Rhode Island. That's key and consistent with how our state health laboratories have been at the forefront of us throughout the entire COVID response. Secondly, indications are that many people infected with this variant of COVID-19 are experiencing illness that is mild to moderate as opposed to more severe. That's helpful. It's still early on, but encouraging. And finally, most experts believe that the vaccines we are administering now will provide at least some protection against the Omicron variant, if not the same level of protection as with other variants. And as we have said, vaccination is our very best tool. The protection that it provides is significantly more than the lack of protection without the vaccine. So vaccination continues to be extremely critical. If you have not been vaccinated yet, or your children in advance knowing about this next coming in place, please, if there is a child in your life who is 5 years of age and older, please get that child vaccinated. As an infectious disease doctor for children and for adults, I can tell you we are seeing increases in cases across the board, but particularly among children, knowing the need to increase our vaccination rate among children 5 to 11 and older. Between Halloween and Thanksgiving, the case rate among children 5 to 9 has doubled, and it has tripled among children 10 to 14. We're hearing from more and more pediatricians, our leaders and colleagues on the front lines who are spending all day talking to the parents of COVID-sick children or COVID-exposed children. These are children who are at the eligible ages of getting vaccinated. We're glad for the work that has been done in getting 94% of adults at least partially vaccinated, but our work is still yet to be done in achieving those levels for our children. Remember, any of these variants target the populations where you have the most number of unvaccinated individuals. And we now have an entire new group of children, 5 to 11 and older, who are eligible, and we all need to make sure that they are vaccinated. There are roughly 200,000 children in Rhode Island, and most of them are still not vaccinated yet. That's the number that we want to focus on addressing. Like everyone in Rhode Island, families with children still need to be vigilant. The best step in terms of vigilance is getting vaccinated. There is plenty of vaccine at dozens of sites throughout Rhode Island right now. Please, let's make sure that our children go get vaccinated. If you are 18 or older, please go get your booster shot. We're holding booster clinics throughout the state, and on Friday, we're holding one at the Rhode Island Department of Health for employees. We want to encourage all businesses and organizations throughout the state to do the same. Push forward on policies for getting your staff vaccinated. Boosters are an important component of that. Businesses and organizations throughout the state can help put in place measures to protect employees, customers, guests, and their entire surrounding community. We are going to be offering more and more booster vaccination clinics, as well as clinics for children 5 to 11 throughout December. For more information, please go to c19vaccineri.org. If you are those businesses or organizations, push on the vaccination, make sure everyone who is eligible, 18 and older, gets their booster, and push for indoor mask wearing, as well as regular testing. This is a critical time. We can't say that enough. We want you out and about, shopping, seeing family and friends, and enjoying this time of year with those that you love. But we want you to also do it safely now that we have the tools to allow you to do so. So what does doing it safely mean? It means getting tested. Testing is an especially good idea before going to any kind of gathering, and it's extremely important if you're experiencing any kind of symptoms, whether or not you've been vaccinated. When you're indoors with people from outside your household, create as much ventilation as possible. Stay home if you're feeling sick. That continues to be a critical message. And wear a mask anywhere. If you're indoors, certainly if you're in a crowded place, and especially if you're at higher risk. Mask wearing is incredibly important. The governor shared that only 20% and probably less of our population is doing that. In addition to vaccines, mask wearing is what's going to be key to getting us through this COVID response effectively, and particularly through this winter. And as I've said, get vaccinated, including a booster if you are eligible. And please make sure to get your flu shot as well. These are the steps we are going to continue reiterating over the next several weeks. Cases are climbing, but we have the tools in place. We need everyone to heed this message, and please stay vigilant. This is the moment, with that extra vigilance, to be able to protect yourself and protect the ones you love.